Welcome back to PPCM's Painful Truth. Today's guest, Julie Simniok.
Thank you, Julie, today for just, talking about your peripartum cardiomyopathy, PPCM experience, all the women survivors that are coming together, talking about their experience. Everyone's different, but we're really putting the pieces together here. Once you watch each episode, or series of each woman talking, you might learn something. So someone might be able to learn something from, your wounds of wisdom about this preventable maternal induced complication. When was your first, or how old were you when you were first diagnosed PPCM?
I was 33.
You were 33 years old. And at what point during your pregnancy you just felt like this is just not right? I don't feel well. And what were those symptoms?
Towards the end of the pregnancy, I was very swollen, but I'd had preeclampsia with my firstborn. Signs were leading to preeclampsia again. I was very tired. I knew that with my firstborn, I worked outside of the home and then during the pregnancy. And then with this one, I was a stay-at-home mom. And I remember saying to my husband, I don't know how I would work during this one, just very tired, very bloated, very swollen. I did have some heart palpitations probably around like the 7-month mark or so, but I told my OBGYN and she said, oh, it's just anxiety, got brushed aside. But it was actually during physical labor that I was like, something's wrong. I can't breathe. And again,
was this at a hospital? Where was your OB located at?
At a hospital. I'm in Wisconsin.
You're in Wisconsin. I forgot to say, what hospital in Wisconsin? I'm actually, my husband was born in Wisconsin.
Okay. It's in Mequon, Wisconsin, which isn't too far north of Milwaukee.
Yes.
It was a Columbia St. Mary's at the time, but now they've been taken out by Ascension. So it's like Ascension Columbia St. Mary's now.
Okay. So, who at that point, when you were getting swollen and you were feeling your symptoms, what were those symptoms that you remember?
Well, prior to labor, I was just tired. Like I just felt really tired. I didn't have the shortness of breath yet. I just felt really fatigued. And I remember thinking, this is way worse than my firstborn. And I thought it was my age because I was 5 years older at that point. So we just were like, okay, I'm older.
It was brushed off. Yeah. Because the issue is, and I'll add on to why, but who, before I get into that, who was it that diagnosed you when you were finally diagnosed peripartum cardiomyopathy? What doctor was the one that diagnosed you?
It was a cardiologist in the ICU at 3 days postpartum.
Got it. And that is so very common. It's not rare. It's rare to be diagnosed. And the issue is that the United States of America does not have a diagnosis instrument or kit in the OB to diagnose the treatment that needs with preeclampsia. It's called the SFLT1. The SFL stands for it's like a solution or a fluid, toxic fluid. The 1 stands for genetic, and the PIGF with the SFLT1 would be the placental growth factor. So what's happening is that women are affected and having induced complications, and I'm currently today trying to get a woman 41 weeks pregnant, having all these symptoms. She was sent home by 3 different hospitals. And it's really quite sad because she's struggling. And so women in America are being sent home from the hospital, being diagnosed from cardiology, not gynecology. Gynecology does not have any diagnosis available for pregnancy-induced complications such as PPCM, which is the NT-proBNP test, which is the blood test, and that's the only test that we can rely on as American women, and that's cardiology. But we're having a baby. We're not, in cardiology. We're in gynecology.
Right.
So this is the issue, in America more than any other country, because our diagnosis is when there's already a threat and complication like yours. So tell me what happened once you gave birth, once you were diagnosed. What were the follow-ups from there? What happened?
Well, I was diagnosed at 3 days postpartum. I had been discharged from labor and delivery, came home. I mean, even just getting up and walking 4 feet to change my baby, I was out of breath. I was wheezing. I had cold sweats.
Yes,
I was like,
infection.
yes, I'm like, I can't, there's something wrong. So my mom was the one who encouraged me to go in, and I did. And then I was in the ICU for, I think it was about 3 days.
Mhm.
And they discharged me on, I mean, since then medications have been adjusted and whatnot, but I was on it, I think 3 blood pressure and heart medications. And then the first step after that was to come back in 3 months for a follow-up an echocardiogram. So I was one of the lucky ones, actually. At my 3 month, they said I was recovered. So, I mean, I hear these other women's stories, and I'm like, I think about how awful I felt, and to think I was not down. I was like 45. I was at like the low normal, they told me, for my EF. And these women who say that they were at 10%, I'm like, I don't know how you stood up, like how you did anything.
Yeah, everybody has a different experience, and yours is definitely traumatic. There is no, for me, there is no degree of, oh, my PPCM experience was, worse than yours. Because once you're diagnosed with this disease, we live with it. It's not something that goes away, because we were left undiagnosed and never treated. And so, pain is how I always say. Like, it doesn't matter if you, stub your toe, or you hurt your back, or your heart is hurt. Pain is pain. And with the swelling and the fact that you were getting worse, is what happens is that PPCM peaks after giving birth. So, I went the whole way. I was never diagnosed, never treated, went to the ER, the infection, all that you were talking about, the sweats, the everything. With fluid comes infection. I had a C-section at 41 weeks pregnant. What were you? Did you have a C-section, or did you give vaginally?
It was vaginal, and I was exactly at 37 weeks because of the blood pressure and the swelling.
Did they
But
induce
again, like
it?
you said earlier, at that point, the OB just was saying, possible preeclampsia. They weren't even really
There are
testing my urine.
assumptions. Yeah.
Right.
The
And then when
assumptions is why we're talking today needs to end. That's the old way. That's the old handbook way. That's the ancient way. That's the 1800s, 1400s way. We actually have studies that have proven, and blood tests that can provide early diagnosis. So there's no excuse. Women don't know to ask for the BNP. The BNP is not provided in standard. So therefore, women are always left undiagnosed. So the education and the training, which we call in medicine practice and policy, has been severely uneducated and unwilling to practice and apply in the medical community in gynecology since the beginning of time. And women have been suffering with this disease over 27, 30 years, as you know, in our group, in our PPCM group. So how is nothing, not a thing, not a one thing has ever changed in even over 30 years from these women that are talking and coming through? There should be some sort of movement, and there's not. So,
well, and even you saying that, I remember when my OB came into the ICU to check on me, and I had never heard of this. So I was bewildered, thinking I was like the one and only, and I'm dying and panicking. And so I looked at her and I said, they say that I'm in heart failure. And she just kind of goes, yeah, sometimes this happens. And I'm like, it does? Because nobody's ever told me that. I've never heard of this.
No. And that's where it's a shame, because what we don't know can hurt us and be a life threat. We didn't know about the BNP. We are not educated or trained even for our doctors. There should be something on like the bathroom walls or somewhere when we're doing our urine test for our glucose or whatnot, and say, if you're feeling, this, and this, and this, and these are the symptoms, then you should request a BNP test and know your EF percent, and maybe consult a cardiologist, because the cardiologists are the ones that are diagnosing American women. In other countries, it's different. They have the SFLT1, the PIGF, which is the toxic fluid diagnosis kit, with the placental growth factor blood kit. They are able to diagnose in gynecology because they have it available. They also don't have to pay for any insurance or medical bills either, because they're completely covered. So American women are severely challenged financially. Insurance, getting vests, entrapment, $5,000 for every 3 months. You don't own it, you have to rent it, and you got to give it back. But you just paid $5,000. Well, if you don't pay it and you don't wear it, then you may die. And that's not okay, especially when we're not left with any diagnosis whatsoever, as well as no treatment. Women are being sent home today, 41 weeks pregnant, crying bloody murder for anybody to listen to her, and they send her home from the ER.
That was my experience with labor and delivery. Exactly. I told them I can't breathe.
Right.
When they tell you to take a deep breath and push, and I couldn't.
Right.
I couldn't
what do
get
they
a
think
deep
we
breath.
are? Mechanical?
Well, and I mean, somehow I did it. I mean, she's healthy. She's 3 years old now, but in the moment, I was so panicked.
It is a very scary position to be in when you're vulnerable and you're sick and you're dying, and everyone's like, you're fine. And you're like, I'm really not. I'm actually writing letters saying to my family, and, at a young age, making the necessary arrangements for when I die. I shouldn't have to be thinking about that. You shouldn't have to be thinking about that. Although I didn't have a chance to think about that. Cedar Sinai, I went to every doctor in East West Tower and to the ER clinic. And, I had his brain checked, his heart checked, and I did everything. And they just never checked me. They said, I was fine because he was fine. They kept sending me home, and then they said, have a nice Thanksgiving dinner. And I literally had every symptom under the sun. I was, normally 105 pounds, blew up to over 200 pounds of fluid. And then 3 months after giving birth, having cardiac death with my baby next to me in my bed, with my husband giving me CPR, and ended up in a hyperthermia coma in Arizona. Thank God, because they had PPCM awareness, peripartum cardiomyopathy. And they said, it's a miracle that I lived, and that it's a miracle I'm not brain dead, because my husband put enough oxygen in my body that when my heart stopped for over 30 minutes, each cardiac death, I was able to have that oxygen stored somehow in my body. And I think it just wasn't meant to die that day.
Right.
And so, hearing, other women, suffer from this during pregnancy, whether you go as far as cardiac death, or you suffer through defibrillator, or you don't suffer through any of that, and you're lucky, but you're not lucky because your doctor did not early diagnose you.
Right.
Your OB did not early diagnose you. You got diagnosed by a cardiologist, and when your life was already at a threat, when your life was at a threat, they brushed it off and they sent you home to die.
Mm-hmm.
So that's basically what is happening to this beautiful woman today who, I had an interview yesterday, and she called me today and she says, I have a girl on three-way. I don't know what to do. The hospital's in Bakersfield, California, where my daughter died at 23 years old, is crying mercy, and they're sending her home from labor and delivery. I mean, this is a real tragedy. This is like the painful truth.
Mm-hmm.
And what we have to struggle with, and hopefully with the continuing consistency of women coming through and saying that happened to me, and the same words that come out repeated, it's like, I think at this point, our voices will be heard, because
I hope so.
We're all saying the same thing.
Mm-hmm.
And what would you tell a woman who is currently pregnant today? What I'm dealing with, she's 41 weeks pregnant. She's been sent home to many, many doctors, many hospitals, and she's fighting a good fight. She is. But they will not take the baby out because they say the baby's healthy, but she's not. And they won't diagnose her. So what would you say to a woman that was experiencing what you were experiencing and where it's being brushed off? What would you say to this woman?
I would just insist that she keep fighting. I mean, especially at 41 weeks. I mean, that's more than full term. I would be saying, why are we not inducing? There's no reason not to at that point. I would just tell her to not, I would almost say, don't leave the hospital. Don't refuse to leave.
Yes. And that's what we tell. That's exactly what, we try.
Mm-hmm.
We try. Did you leave?
Well, so like I said earlier, most of my, like this, I guess when I first started realizing for sure there was something wrong was directly in the middle of labor when I couldn't breathe. I called in a nurse. I said, I can't breathe. I think I'm having a panic attack, because I didn't know what was going on.
Right.
And I remember her asking me, well, what do you do for panic attacks? What's your plan? And I looked at her and I said, I don't have a plan. I don't get panic attacks. I don't know what to do. And so she put me on oxygen, and that helped. But they still were like, oh, it's just your anxiety. The oxygen is acting more of like a placebo, kind of making you think you're feeling better. And I'm like, okay. I still kind of like bewildered, like I still didn't know that PPCM existed. So I'm thinking, okay, well, they're the nurses. So I'm convinced I'm still having a panic attack. And yeah, I did get discharged. She was born on a Thursday. It was actually on Thanksgiving. And then I went home on Saturday. And then it was Saturday night that I struggled. So I couldn't do anything. I couldn't do anything.
What
and
year
then
on Thanksgiving?
2018.
18?
Yeah. So November 22nd, 2018. And I just struggled so hard that night getting up for feedings and getting up for diaper changes. And the next morning, my mom looked at me and she said, you need to go to the doctor. There is
Mm-hmm.
something wrong.
Mm-hmm.
I don't think if she had pushed me I think I would have gone in eventually, but I don't think I would have gone in that day if my
Mm-hmm.
mom hadn't basically told me I had no choice. We were going.
Yeah.
And, I think I'm lucky she's a nurse. She had never heard of PPCM, but she could tell like there is something wrong.
Right. Well, we know our bodies, and you knew that there was something wrong, obviously. Yes. We know our bodies. We know when it's hard when you're not being listened to.
Mm-hmm.
And that's the one thing that's continuing, and I hear it every single day. I watch young women, say the same things over and over and over again, and I don't really hear very much. Sorry, that's my puppy. I don't hear
Okay.
very much advocacy during this.
No.
It's like okay, we're all a soundboard to each other, like, but the help that we need, mental health, is very important. It's not as available as it should. Even with, May 2018, I attended, Moms Congress to support and talk how important the bill is, because women with PPCM, I mean, you can't get PPCM and be diagnosed with peripartum cardiomyopathy and not go through a depression or fear, right, and
definitely
major PTSD, major anxiety. And then we're confused. Is it anxiety or is it heart failure? And we're like, right, now I'm confused because they were telling me it was anxiety, but no, I was having heart failure. But now my saying my heart is fine, but now am I having anxiety? So it's like, we're constantly trying to like figure out this disease on our own as survivors, mentally.
I mean, it's been my primary physician who has continued to follow up with me. And I remember, I can't say for sure that she had never heard of it. Maybe she had, but I do know that she was not really sure what to do at first. And I remember her coming in late to my appointment because she said she was consulting with another physician because she wasn't confident on what to start, what medications to go with.
Right. And I think that's also who also needs advocacy are the OBs, advocacy with mental health. And I believe that cardiology is the mecca to start with, confirming or at least brainstorming or, approving this, because it all comes now down to cardiology. Cardiology in America is what we are left with as women who are pregnant. And, it's very important. There's collaboration, which I have collaborated, or was a big part. I played a big part in Dr. Carol Watson at UCLA and gynecology, having Zoom meetings to listen and to learn and be educated. And, Dr. Watson, she's the director of the Barbara Streisand's Women Heart Association program. She's the head of the Women's Heart Center, cardiology center at UCLA. And so I feel like with her support, backing up this disease and supporting my growth of, PPCM Fund, with helping women that are suffering. They get sent home from ERs. I can send them to her, which I'm very grateful, as a backup option to save a life. I mean, I'm just a survivor, but I feel like women don't have a platform, really. The platform has been other nonprofits doing the best that they can, to make this really be heard. The
Mhm.
women, this is not about me. This is not also really about you. You and I are coming together to make sure that this doesn't happen to our children and to our children's children.
Right. And I
Because it's
am, I would be interested. I haven't myself found a lot of information about genetics with it. I've heard that it can be, not sure if that's proven yet or not. I've always wondered since finding out about my diagnosis if my maternal grandmother had the same thing, because I always heard about her with her youngest child um, being basically bedridden and very swollen, and her neighbor had to come help her put on her compression stockings every day. And I don't know, but I definitely want to do as much as I can and learn as much as I can, like you said, for our children. I have two daughters, and if it does turn out to be more of a genetic thing, I want to know how I can help them.
mhm. Yeah, exactly. I think that this is what's going to help. I think it's not just you talking, it's not just me talking, it's women from Scotland, women from Canada, women from England, women from all over, the United States. It's all over.
Right.
You know what I'm saying? Um it's all of us together moving this forward, with each individual having the same words, the same fears, the same, issues.
Hmm.
And there's really an easy, practical solution to a very serious problem. Make the tests and screenings and labs mandatory for
Yes.
gynecology to have the diagnosis, take that diagnosis, give it to the cardiologist at early diagnose, maybe at as early as even 10 weeks pregnant, which was me, which is available with the BNP test, or
Hmm.
get the SFLT1 and the PIGF, the cardiotoxic fluid test mixed with the placental growth factor, and make that available in gynecology like they do in Canada, like they
Hmm.
do in other parts in other countries. So that's kind of like our American dream as
Yes.
women.
Yes.
I mean, I thought, even with my mom, like, saying like, women have come such a long way. We have come such far ahead in history, where we now, have our own business. We have, but we're still not there yet,
Right.
because women been giving birth since the beginning of time. And you're telling me that you were sent home with no treatment, no
Right.
diagnosis, no care. And I know how that worked for me. I had a
Right. You know what
cardiac
I
arrest
was?
with my son in
You want to
bed.
know what I was sent home with? Now that I
What?
think about it,
What?
Xanax, because I was told it was anxiety. They sent me home with Xanax and told me to call
And
my primary physician on Monday.
and that's an addictive drug. And I
Yep.
always say, and I'm a licensed clinician, like social worker, actually. I have my
Okay.
master's in social work. I was a
Okay.
triage specialist, actually,
That's
at
awesome.
once upon a time. And I always, always, when communicating with a psychologist, advocating for somebody else, having them either admitted or in some way, I say only non-addictive medication. There are so many. I mean, and addictive medication, you have to be careful, because
Hmm.
when you have fluid, that can counteract and induce a cardiac arrest, because it can either drop and give you, very, very low, you know, heart rate, or it can spike it up and give you, a hypertension. You can't do that because it wasn't mental health issue. It was something
Right.
physical. And it's
Right.
also something addictive. They could, if they don't know if you have like an addiction,
Right.
I mean, like,
I mean, I never even ended up using any of it because the next day I was in the ICU.
well, it's a good thing that you didn't. I
Right.
mean, it
Right.
knocked you
Um,
out.
I
Who knows
know.
if you would have woken up?
I know. No, I
Dangerous.
didn't even use it, but um I just, like I said, I didn't know what was going on. I had never heard of it. So I'm
They're giving
there,
you medication on an assumption because they didn't give you the diagnosis test.
right.
Did they give you a chest x-ray?
Not, I'm trying. So funny how when time passes and you're like, that was 3 years ago. But no, not in labor and delivery. Um, and then I went when I was in the ICU, they did the chest x-ray. They were hoping to find, not hoping, but the lesser of two evils was a blood clot in my lung. And there was no blood clot. So then they did the echocardiogram, and then that's how they found it.
They found it through the echo.
Yes.
Okay, and that's exactly what also needs to be mandatory and standard in the screenings, labs, and testing is the echo, because the echo is the one that is in fact diagnosing women as PPCM.
Right.
So it's the echo, it's the chest x-ray, it's the NT-proBNP test, it's the SFLT1 with the PIGF, and those are what needs to be added as the standard testings.
Yeah, I agree. I've, ever since it happened, I've been vocal to
Good.
anybody who will listen,
Yep.
and I don't, for the most part, I don't think anybody has ever heard of it. When I do talk to anybody about it, actually, even for this interview, I was telling a coworker last week, and she said, "For your what?" And she's a newer coworker, so she hadn't really heard my story. And she said, "Your what?" And I said, "My PPCM." She was like, "What is that?" And I said, "Well, peripartum cardiomyopathy. It's basically pregnancy-induced heart failure that I experienced when Vivian, my youngest, was born." And she said, "I have never heard of that." And I said, "I know, most people have not."
And same. And why haven't they? How
Right.
come we? When it's so common. And they say, oh,
And
it's just rare. But how can they say it's rare if they don't diagnose? How can they
right.
even make an assumption? So everything is based on assumption. And the facts is that, yeah, I went like balls to the wall and contacted like literally like thousands of offices, spoke to
Good.
so many women within the United States of America, Texas, Georgia, Atlanta, Alabama. Texas was a big one. New Jersey, Virginia. Not one OBG, not one rep, not one representative, nobody has ever heard of this.
Right.
And it's every 3 minutes a woman suffers. One out of 4. But this is a global assessment because we don't have anything to base it off of in America.
Right.
Because we don't have a diagnosis unless you're in cardiology.
Right.
And so they say, 2,000 cases, new cases in the United States of America. Based on what? Based on the cardiology? And what we know, but what about what we don't know?
Right.
Because we don't have a diagnosis. So it's really quite appalling, unacceptable on every level. Where I am grateful for you to talk up and speak up.
Well, I'm
It
grateful for
is.
you for coordinating all of this. This is awesome. I mean, like I said, I tell anybody who will listen, but I am not, I have no connections. Honestly, it never really even occurred to me to call like you called around, and as much as you've advocated, I try to advocate locally, but it never even occurred to me to do that. So I'm very glad that you are and that you have.
Well, I do my due diligence, and I do have on our website, the PPCM Fund website, a downloadable form or
Okay.
flyer. And I usually have it updated, and I might even update it again and add some other things to that are very specific, and see if a doctor or a OB will allow it be taped up in the bathroom.
Yeah.
We'll give the descriptions of, like, if you're feeling this, this, and this, and this, request your BNP test, request an echo, because the
Right.
echo is the most important. And I'll change and add that to the flyer. And then, I think that's where we start, is
Mhm.
training and educating. And the thing is that we push rewind and play, and we're living our own nightmare over and over again.
Right.
And it really is falling on deaf ears. So
Yeah.
here we are, breathing our air, the life that we have, our breath, trying to spread awareness, and it's not connecting.
Right.
So there are steps that need to be taken in order for there to be some sort of real change. And the platform, our docuseries, the podcast, you have any TikTok videos, tag at PPCM Fund Survivors. It's a platform for others to see
Yeah.
on one platform, women coming together. And I mean, there's this one, Amy's TikTok. It's not funny, but I love that she put humor behind it, because she's like, it says, "Oh no, oh no, oh no," because every time she had like 8 doctors, and they just kept walking in, walking in. She's
Mhm.
like, "I love seeing my favorite cardiologist," and another one, and another one, and another one, and another one, every 6 months. But it was like they just kept coming in, and the music behind it was hysterical, but it's not funny, because it's real.
No, but that's a coping mechanism for sure for a lot of people.
Yeah,
So,
it is. I remember I was laughing on the floor when I was saying I was dying, and I was put on hold by a nasally receptionist that gave me this awful music. And I'm like, I'm going to die and listen to this music. I was like, oh no. It was,
right.
I had a moment with my mom, and I was laughing hysterical. I mean, I was dying, but I thought it was funny,
Right.
because I'm like, you want me to hold for how long?
Right. Sometimes all you can do is laugh.
Yeah.
Right.
Yeah, it's insane. But no, I really do appreciate you. Is there anything that we didn't mention that you would like to add that has been missed during your journey?
Um, I don't really think so. I think just if if a message I would give is just if anything feels wrong, even if it ends up not being PPCM, it could be, you never know. Just your body. And you need to advocate for yourself, because
Self
I think
advocacy, yes. Hmm.
back to the closer to the beginning of my story, when I said if my mom hadn't said we are going to the hospital, I think I would have gone eventually, but not then and there, and I did know something was wrong with my body, but here I am, 3 days postpartum. I have a 5-year-old at home. I have my newborn, and I'm thinking I can't leave them. I can't be separated from them. So I'm going to tough this out. That's what moms do. I'm
Hmm.
going to tough this out. But my
Right.
mom I'm her baby. And she's like, nope, we're going. So
Mhm.
you got to listen to your body.
Absolutely. And I agree. I mean, and that is what every single woman exactly to the T says. It
Hmm.
is unanimous. I'm going to do a video where I'm going to capture every woman saying this, because we're all
That would be
saying,
cool.
whether you're in Scotland, Germany, England, I mean, I've talked to everyone, and every woman says the exact same thing. And that's what's going to be consistent: self advocacy.
Yes.
And that shouldn't be. We shouldn't have to, like,
No,
we're
but
relying on the medical community to give us a diagnosis. But no, we have
right.
to rely on self advocacy. And it is unanimous. It's like what every single woman says as I end the interview. And
Hmm.
that speaks volumes.
It does.
I'm gonna clip it, and it could be like I mean, I have over hundreds of interviews I've already done, like, about that, like, nonstop. So it can
But that's
go on.
wonderful. I'm so glad women are willing to talk about it. I was very nervous, but I'm like, but I'm going to do it. I'm going to come on and talk about it. I'm like,
We
where do I
have
sit in
to.
my house? I don't know, but here I am.
Yeah, no, we have to talk about it. These discussions need to be had.
Hmm.
Even my cardiologist, Dr. Kara Watson, she says these conversations have to be talked about.
Hmm. They
She
do.
even says, I have a video of us when she was doing my appointment. And she says, this, that's why she's so passionate about it. And she also started a Zoom call, you know, with, with cardiology as well as me. I have one on February 1st, but she says, these conversations have to be had.
Hmm.
It's not even a matter of wanting, they need.
Right. I agree.
And every woman adds a little piece to the puzzle,
Hmm.
on this big, huge, global woman pregnancy movement. Every little piece. And I think that what's going to really catch the public globally, that's hasn't been diagnosed yet, hasn't been aware of this yet, it will we are educating them by
Hmm.
talking about it. And the only that's the only self-advocacy that we can do for our children's children, is to, you know like, just put all vanity and all ego aside,
Hmm.
because it's not about, again, it's not about me. I already have the awareness.
Right.
It's about my niece,
Right.
who thinks it can never happen to her,
Right.
when genetically it possibly could.
Hmm.
So no, yes, self-advocacy. I'm gonna do that video, and I think it's
Yeah.
gonna be like over an hour long, but who cares? It might be
Yeah.
comical that way, because it's gonna just go till the very end.
Right.
It'll be
Well,
nonstop.
unfortunately, at the end of the day, though, you just have to listen to your body. You're your best advocate, being yourself.
Absolutely. And every person knows their body. Every person knows what makes them happy,
Right.
knows when they're, if they're depressed, their mind is telling them, be aware, help me. Just don't ignore it. It needs treatment. There's nothing wrong with mental health. There's nothing wrong with
No.
non-addictive, good medication.
Right.
And, and I believe in, you know, the empowerment of survivors that are going to push this where it needs to be, you
Hmm.
know. And I can't do it by myself. It happened to me. You can't do it by yourself. It happened to you.
Right.
This is going to take a lot of communication, a lot of being just doing it in a way where we're actually being heard, not just
Yeah.
like, oh, I've never heard of that. And then you go off and you get your hair done, you get your nails done, you have your dinner, you wake up and you go through the same thing over and over and over again. There will never be change.
Right.
And
Well, I think that things like, communities on Facebook have helped us realize we aren't alone. I mean, that's one of the first things I did was search Facebook for a group.
absolutely.
I was like, I need to find other people. I need to talk to someone about this. And
Yeah.
I think now that we're all coming together and realizing how many of us there are, that's now we're like, okay, well, enough's enough. Now we are going to start demanding that change.
Mm-hmm. And I think that we are doing it right now.
Yep. I do
As we
too.
speak.
Yeah.
Thank you so much.
Thank
I
you.
again, it was such a pleasure meeting you, and
You
like,
too.
just, I know we know each other on Facebook, and but it's nice
But
to
speaking
connect.
almost face to face, not real face to face, but close enough.
This is good enough. I got
Right.
to know you, your your survival story, and how you're passionate about educating others, so this preventable catastrophe doesn't happen to another family or another
Hmm.
woman. And I
Right.
commend and respect you for that, because it does take a lot to show up sometimes with something so painful, and to talk about it. So thank
Well,
you.
thank you for giving me the opportunity.
Absolutely. I look forward to our journey together, and see how this unfolds.
Yes, me
So,
too.
have a lovely day, and yeah, I think this was your magic minute for peripartum cardiomyopathy.
All right. Thank you so much.
Thank you too. Bye-bye.
Bye.
Thank you for joining us and listening to the PPCM Fund podcast. If you haven't already, please like and subscribe. PPCM's Painful Truth is made possible through the generous support of donors like you. Help us spread the awareness by donating at ppcmfund.com, or click the link below to become a member through Ko-fi. Have a great day.